Coming to question number 3, a 24-year-old man has these lesions on the face. Which of the following is the best treatment? Okay, so this is a question that was asked in the NEET PG 2024. What do you see in the image here? In the image, we see these bigger nodulocystic lesions, pustules, comedones, papules. So basically, this is acne. This is acne. What is the primary lesion of acne has been asked multiple times in your exams. Primary lesion, despite all the papules and the pustules that you see, primary lesions are the comedones. Now, tretinoin is used in the treatment of acne, but tretinoin is generally effective in grade 1 acne, which is comedonal acne. In this acne, tretinoin may not be effective. Doxycycline would definitely be beneficial, but what is the question asking us? Question is asking us best treatment. So even though we can give doxy, we can give isotretinoin, but what is the best treatment for acne? Best treatment is always isotretinoin, okay? So remember, when it comes to the question, read it properly what it is asking. It is asking us best treatment, that is isotretinoin. Isotretinoin is not used in acne. Isotretinoin is used in psoriasis, pityriasis rubra pilaris, and the congenital ichthyosis. It is not used in acne, even though it's also an oral retinoid, but we don't use it here. The correct answer to this is option B, that is isotretinoin. See, this is the acne. When you see these black comedones in the image, these are all the comedones, the blackheads, the open comedones, which we see in grade 1 acne. Here, the drug of choice is topical retinoids. Remember, what are the topical retinoids that we can use? Tretinoin, adapalene, tazarotene, and a newer retinoid, triferritine. So these are the topical retinoids that we can use in the treatment of acne. We can also use topical salicylic acid in grade 1 acne, but remember what is not used. This is a question in the INI. What is not used? Steroids are not used in the topical management of acne. That's a very important point to remember. Never mark a steroid in the treatment. And then we have this grade 4, that is nodulocystic acne. This is the most severe acne. You see these pleomorphic lesions. Drug of choice, oral retinoids, that is isotretinoin, given at a dose of 1 mg per kg per day. Most important side effect, teratogenicity, not to be given in a woman of reproductive age group without doing the UPT. UPT has to be negative. She has to practice double contraception, a gap of 1 month between stopping the drug and planning the pregnancy. And these are all the important points that you need to remember about treatment of acne. Tell me one more thing. What is the bacteria that is responsible in the pathogenesis of acne? So what is the bacteria that is responsible? This was a question in your 2021 December exam, I think. They gave an image of acne and they asked which of the following microorganisms is involved in the pathogenesis. That is Propionibacterium acnes. So Propionibacterium acnes is involved in the pathogenesis of acne. Then you've got questions on what is the primary lesion that we've already discussed. That are the comedones.